Welcome to our presentation on the impact of electronic health records on the management of diabetes by Group 4. The goal of this presentation is to explain and foster the evolution of electronic health records, also known as EHRs, as it impacts the management of care of chronic diseases like diabetes, also to bring awareness of how EHRs can benefit the management of diabetes. In order to understand how EHRs can enhance the care of diabetes, let's first look at what diabetes is. According to the Canadian Diabetes Association, over 9 million Canadians are living with diabetes or pre-diabetes. Since the year 2000, the prevalence rate of diabetes has almost doubled, and that by the year 2020 it's estimated that 11% of Canadians will be affected by this disease. That's 4.2 million patients. So, what is diabetes? There are three main types of diabetes. First is type 1, which is 10% of diabetics, where their pancreas does not produce enough insulin. Next is type 2, which is around 90% of diabetics, which develops in adulthood, and the pancreas does not produce enough insulin, or the body does not effectively use that insulin. The third type of diabetes is named gestational diabetes. This is a temporary condition that occurs during pregnancy. If your blood glucose levels are high, but not high enough to be diagnosed with diabetes, you are what is called pre-diabetic. Diabetes can lead to multiple health conditions such as heart disease, kidney disease, eye disease, and nerve damage. However, with the proper management of their condition, these complications can often be avoided. In the past, diabetes was managed with paper-based records. With the widespread implementation of EHRs, diabetes is now being managed by EHRs. EHRs allow for greater interoperability and flow of patient information between healthcare providers. To understand EHRs, let's define it. The electronic health record is a longitudinal electronic record of patient health information generated by one or more encounters in any care delivery setting. Included in this information are patient demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology report. This definition is from our textbook. Another definition, as reported on the Health Information Management Standards Society, defines EHR as having the ability to generate complete records of clinical patient encounters, as well as supporting other care-related activities directly or indirectly via interface, including evidence-based decision support, quality management, and report outcomes. EHR systems include health databases and registries. To include some of the standards that are needed in Canadian EHR systems are client registries, list of all patients and their relevant personal information, provider registry, list of all participating healthcare professionals who can access records, diagnostic imaging systems, which are electronically stored diagnostic images that a healthcare provider can access, drug information systems, allowing healthcare professionals to access manage the patient's medical history, laboratory information system, allowing patients' lab tests to be viewed by multiple people at a variety of locations. Interoperable EHRs allow the sharing of complete health records by different healthcare providers. A discharge abstract database, also known as the DAD, that contains demographic, administrative, clinical, and hospital discharge. The National Ambulatory Care Reporting System, and also the Ontario Diabetes Registry, which was recently cancelled due to system not being able to meet the deadlines. EHRs can be used in a variety of settings such as hospital, family physician, outpatient clinics, walk-in clinics, and hospital laboratory settings. Complete EHRs can be made available to numerous healthcare providers simultaneously with up-to-date data. However, it's found only 37% of family physicians in Canada utilize health records in its digital format, compared to other countries such as the Netherlands that have 99% of their family physicians utilizing EHRs.